Okay, you guys, so I'm Catherine Davis, and this is my colleague,
I am Heather Sommer.
Heather. We're both speech-language pathologists. We work with the pediatric population in the outpatient setting. We're going to cover when, where, and how to refer and the role of the pediatric speech-language pathologist, and we'll just abbreviate that and call us SLPs. We work at the University of Texas Medical Branch at Galveston, and we're in the Department of Otolaryngology under the Center for Audiology and Speech Pathology. So the purpose of this presentation is for you all to understand what we do as speech pathologists. That's the first thing. The second is we're going to cover the relationship between what you all do in ENT otolaryngology and how that connects to us. We want you all to be able to understand why you're referring to us and when it is appropriate to refer. And then also we're going to provide you with some information from our American Speech Hearing Association website, which has not only resources for you all as providers, but also will have some resources for parents as well. So that's what we're going to cover today. Okay, let's see. I hope you can see the QR codes there. But within the SLP scope of practice, there's a lot of things that most people don't realize that we do. You hear in our title speech and language, but those are just two of the areas. So the first thing being fluency, so you might be familiar with stuttering, perhaps not cluttering so much. Even when we go down to language, that's a broad area within itself because we're looking at not only comprehension of what's being said to us, but also expression. And then we build from that and go into the written reading and written form of language. And then again, even then within that language area, we also have pragmatic language skills, so social language skills, gestures, I'm using my hands to talk, and I'm using facial expressions, and those are all within the area of language. Cognition, so in the pediatric population, we don't see as much of this when compared to in the adult population when we're talking about memory and problem solving, some of those later higher developing or higher skills. In voice, which you might see often being an ENT, resonance, which is how that airflow comes out when we're talking, whether through the mouth or through the nose, feeding and swallowing. And we also work closely with audiologists in auditory rehabilitation and rehab, so patients with hearing loss. Over here, this QR code is a link to a YouTube video that I made, which you guys can use this, you can watch it later, but I also made this for parents as well so they can understand when you refer to speech, to pediatric speech, they're gonna know what we do. So there's also a link to our ASHA website as well, which goes into great detail, but we just wanted to briefly cover those. So why is this important? How is this related to what you all do? So these are some things that are often referred to you, things that you see in a pediatric otolaryngology clinic that are oftentimes referred on to us, and then we evaluate and see how that is impacting the child and their communication skills. So I won't read all of these because you're probably fairly familiar if you're working in pediatrics, but these are things that oftentimes, like I said, impact their speech language, not only speech language, but like I said, feeding, swallowing, all the voice skills, all those kinds of things, and then what you might refer on to us.
Alrighty, this is Heather, and I'm going to go over some more specifics about how to know when to refer, because as you know, different skills are developing at different ages, and we wouldn't require you to memorize all this. That would be too much, and you're not a speech language pathologist. You shouldn't have to. So fortunately, this information is out there for you to easily access. The first thing that's listed is the speech and language developmental milestones. They're on the ASHA website. The QR code and the link is to the right. And those are really nice because it has developmental milestones for each year of life between birth and 5 years. And you can print those out. What we did is we print them out and we have them in a folder in our clinic. So the nurses or the doctors or the audiologist, whoever, can just quickly grab it. If the child is like a 2-year-old, you grab the 2 to 3-year-old one and give it to the parents. On the top, it has what skills are kind of expected at that age. And then underneath it, some ways that the parents can help. That can also guide you if they don't have any of those skills they should for their age. That might be an indicator for maybe there is a speech and language delay or disorder, and a referral might be necessary. So that's on the ASHA website. Right below it, Catherine had made a little chart. It's kind of a one-pager because those are, each year has a page. This has all the, ages on one page. So it's a that you're not going to hand necessarily to the parents, just for you to reference. That's the second thing. Oh, and back to the ASHA milestones. I said they're birth to 5 years. They're also in Spanish. They have them in English and Spanish. And there's also one on there about children that have 2 languages in the home, because we get that question a lot. So there's a handout about that too that you can easily print and hand to parents. Also, like she had mentioned, feeding and swallowing is something else that is in our scope. And the third thing there is the ASHA information on that. And then underneath it is a little kind of quick cheat sheet, like quick guide for some feeding and swallowing. What are some things that may be indicative of problems, and what it all entails. So that's kind of just gives you an idea of what's typical development for each age and what isn't. So that's just, it's a lot of information. Like I said, you don't have to memorize it. You can just print it and have it at your fingertips. So the next 3 slides, what we did was came up with some quick screening questions. This would be a good thing for you to use during your appointments with the families. The first slide, the first question I think is really important. Does your child become very frustrated, very upset when trying to communicate, or avoid talking altogether? This is really indicative of there could be a problem. This is a big red flag for me. Because you may just have quiet children that don't talk much, but if the child is trying to communicate and getting really upset, that's a red flag. That would be something I would be like, refer for speech and language testing, because you don't want them to get to the point where they don't want to talk. So that's a good one. Then have a couple little quick specifics. The next one is, how many words does your child say? So first words usually appear about 12 to 15 months. By about 18 months, they should have about 50 words. And then by 2 years, they should have a couple hundred. And then how many words is the child stringing together? So by about, it kind of correlates with the age. So at 1 year, you're hearing 1 word at a time. 2, they'll start pairing 2 words. 3, give or take. Some kids might progress a little quicker than that. But that's kind of your general kind of what to go by. If it's very off from that, again, that's a red flag. If you've got a 3-year-old that's only saying 1 word at a time, that could be indicative of a disorder. Then when we talk about our speech production, articulation, how clear is the speech? That again might pop up when you ask the first question about, are they getting frustrated? Because they may know exactly what they want to say, but it's not coming out clearly and no one can understand them. So on a scale from 1 to 10, 1 being 10% of the time and 10 being 100%, how often do other people who are not familiar with your child, like not the immediate family, how often do they understand their speech? And if you look at, there's a little formula below. So parents that are saying, I can barely understand my 2-year-old. Well, can you understand him half the time? Yeah, okay, well that's, or can other people understand them half the time? That's to be expected. But if you've got a 4-year-old who other people can understand less than half the time, that's not typical. That's something that's indicative of a speech delay or speech disorder. Okay, so then the third one, the third slide we made with our quick screening has to do with feeding and swallowing. And these are just 4 quick questions you can ask. How long does it take to feed your child? Are mealtime stressful? Has your child lost or failed to gain weight? And then are there signs of aspiration? Of course, aspiration meaning food or liquid going down into the airway. There are different signs we listed under here, little symptoms you can kind of probe the parents with if they're not sure exactly what the question is going for. You can ask some specifics like, are they getting more congested? Do you hear gurgly voice? Do you see a lot of tension or strain when they're eating? Also, a quick note would be usually by about 6 months or so, kids start to be a little more aware of their, their body and how to control things. And so they might start refusing food because they know last time it was hard or it went down wrong. Even if they can't express that verbally, they'll do that behaviorally by not wanting to eat. So that might be a sign that they may be doing some silent aspiration, which means the food's going down the airway, but there's no visible signs to us. They're not choking or coughing food up or anything like that. So once you've asked all these, questions to the parents and you have determined that, okay, there are some areas of concern, they're not demonstrating age appropriate skills, or they're having a lot of difficulties they shouldn't have at their age. Once you've determined that, then you will want to refer for a speech and language evaluation. So where do you refer? There are lots of different settings that SLPs work in with children. If it's a child that's under the age of 3 years, early childhood intervention, or ECI, is a program that comes to the homes and helps the families working with and works with the children. What you'll do with that is you can look online and see where the local ECI providers are in your area. And it might be good just to have those numbers on hand so you can give those to the parents. When you will make a referral, but it's good to give them the number as well so they can call. Outpatient clinics like the ones that Catherine and I work in hospitals, there's usually there's usually a process that you probably know. If it's in the hospital you're working in, you'll be able to send it in. Home health, there are home health agencies that come into the home, private speech clinics, and then of course public schools. A side note on the public schools. So you may know that children age 3 and older can receive services from the public schools if they have a disability of any kind that's been determined by formal testing. The only exception to that is if the child has a hearing loss or a vision loss, they can receive services through the school district from birth. So a lot of people don't know that. And so it's really good to make sure the parents know, hey, have you contacted the schools? Well, my kid's only 3. That's okay, because if your kid has a disability, the schools can provide services starting at age 3, unless they have a hearing or vision loss. In that case, it'd be 4. And we'll talk about that a little bit more in a minute. What was I say? So what is the process? Like I said, you can send the referral. You as an ENT can make that speech referral. Sometimes they come from the PCPs, but they can come from you as well. I have several patients I have that have come from ENT referrals. So what this will look like for either ECI, outpatient clinic, home health, or private clinic is you will send the actual referral. There'll be a process in place depending on where you work. It may be a little different. So just kind of ask, what that process is. Be aware of that process. So you'll send your referral. In your referral, it's very helpful for us if you will be kind of specific, a little more specific about what the exact concern is. Instead of just saying speech delay or speech concerns, go back to those when to refer quick screening slides when you were asking the parents those questions. What was it they said that concerned you? What specific thing? And you don't have to go into a lot of detail, but just a simple thing like the child is 3 and only saying 1 word at a time, or the child is 4 and less than half of the people understand him less than half the time, or the parents are worried about stuttering. The child gets very frustrated when trying to talk. just a sentence, just a little something, so we know how to prepare for that how to best prepare for that evaluation. And, you know, including any notes from the caregivers as well. The family is concerned because of, and just a quick statement on that. So once you've sent your referral, you also will want to make sure they have an audiological exam prior to the speech and language evaluation. This is really good. You want to make sure that there is not a hearing loss that might be impacting it. If there is, you want to address that, because that's really going to have an impact on how speech and language therapy progresses. And a lot of insurance companies require this for young children especially. And then also some insurance plans will require a well child check within the last year. So make sure when you're making these referrals that if you need to make a referral for the audiological exam, if they haven't had one recently, and same with the well child check, if they haven't had one recently, make sure you encourage the family to do that. So that's those settings. For the school process, if the child is 3 years or older, or if the child has an auditory visual impairment, you know, it could be from birth. So if the child has a developmental delay or any other disorder, if the child is not yet enrolled in school, but is 3 years old, the caregiver can call the special education or the early childhood department in their local school district. So encourage them to do that. And then they'll just ask for a special education evaluation for their child. If the child already is enrolled in school, then the caregiver can just discuss those concerns with the child's teacher and just encourage that. The teacher can help connect the caregiver and the family with those supports needed, including the SLP. If the child has an auditory or visual impairment, if the child is under 3 years old and receiving services from ECI already, then the caregiver can just ask that ECI provider about AI and BI services through the school district and they can connect them. If the child is not receiving ECI, the caregiver can call the special education department in their local school district and ask for the contact information for the deaf education program or the VI program, depending on what the concern is. And that's available for them.
So we put that information as just a side note in there about the schools, because you're not necessarily going to refer to a school, but it's just really good for you to know, because a lot of times we'll get parents or we'll get children in here, we see them and the parent, we say, you know, okay, your child is 3 years old and they have a speech delay, you know, you can get services at the school district, and they say, no, my child's only 3, I can't do that, I didn't know, you know, so they just don't know. And so that's just good for you to know, so you can tell the parent and encourage them to do that, like she said. Okay, so once they're referred, we take over from here. But there's just a couple of things that we do want you to know. We'll do a full evaluation. We look at all of the areas within our scope of practice, at least note it in our evaluation. If they do qualify, we'll submit it to insurance for authorization. Sometimes the insurance does need a signature on the evaluation, so you'll get it back, just a note, so you know that it might come back to you to sign off on that. But then this is a big thing, you know, once referred, and it's, you know, that there's oftentimes a waiting process or a waiting time between the time that you actually refer the child and the date of the evaluation, whether it's insurance issues or there's a wait list, there's going to be a waiting period. And not even from there, or not only from there, but from the time that they're evaluated to the time they actually start therapy, there's often, like I said, some waiting time. And so we really want you guys to have the resources for options for home programming, just things that parents can do at home. And that goes back to what Heather was talking about with the ASHA link several slides back. Not only do they have those milestones, but they have below, if they're not meeting these milestones, and here's things that you can do. So they have a good list of resources or activities they can do at home. And then not only that, we also, during this Corona crisis and the downtime that we've had, not being able to see all of our patients face to face, we also made some YouTube videos. So let me see. So there we go. Okay, so Heather and I made some YouTube videos. Mine are mostly for parents, more instructional things that they can do. Over here on the left side, you can just scan that QR code and or use that link and provide those videos to parents. Heather made some instructional videos, but a lot of videos for the kids directly, some interactive videos that they can watch and enjoy, since a lot of them are interested in technology and videos and YouTube and all of that. So anyway, those YouTube videos we hope will be a helpful resource as well. I also did put on my channel some links to other speech language pathologists, so lots of videos that parents can watch at home. Let's see. Okay, so after we've waited and evaluated and getting started in therapy, we wanted to show you some things that we actually do, because you've sent them on to us and that's great, but now what do we do with them from there? So these are some pictures that I've accumulated over the years in my therapy sessions, especially so I can show parents this is what we did today. Anyway, so I have this little card track up here. We'll put the articulation cards, the speech sound cards around the card track. We'll roll the dice and we'll race around the card track. Every time you land on a card, you have to say your word. Down here, we were drawing with chalk. She was working on the SH sound, and you'll see a little starfish right here. There's a fish. She's wearing shoes. So everything I was drawing, she had to say the sound, say the word with her sound in it. So this is something that you guys might refer to as, like I said before, in otolaryngology. This was a patient with vocal nodules. She isn't quite reading yet. And so we allowed her to draw her own pictures. She did come up with these things that hurt her voice and things that she knows that she shouldn't be doing, because we talk about things that might hurt your voice, and we really listed those out. And she was really proud of this when it was all said and done, because she had come up with these on her own. And then of course she drew her little pictures, and then we talked about things that she can do instead to help promote that good vocal hygiene for her voice. And then right here, down here, this pacing board, this is similar to what we often use in therapy with children who are stuttering or cluttering. That is, their forward flow of speech isn't very smooth. So we'll use this pacing board. They touch each of the shapes in the boxes to slow their rate of speech. So that's something else that we use in therapy. Just one more slide here with things that we do, just to show you that it is fun and games, but also they're getting a lot of this. So you'll see over here, we were making Play-Doh to the child, but also we have, you see the numbers on there, we sequenced it 1 through 5. And so as we were going through, they could predict what we were going to go do next, because there were picture supports on there. And then when they take this home, they can tell the parents, this is what we did today. And so they can work on their language skills that way, some past tense verbs. We can look for words with their sounds in it, so much stuff. But the kid comes out and said, we made Play-Doh today. It's so much fun. So that's something we do often, is make things. Over here, these in the top right corner, these are picture supports that we use often in therapy, not only for children who are building their language skills, so they can touch the picture here and say, I want more school bus, but also for those who are what we consider to be nonverbal, that meaning that they're not producing words with their voice, so they can just touch the pictures and say, I want more. So we use a lot of picture supports in therapy for sure. Down here are a couple more activities that I know I use often. That's picture scenes. We've got these reusable stickers and these felt dolls over here, and we can do a whole bunch of stuff with those two types of activities. We can work on joint attention skills. We're both playing with this at the same time. We can work on some role playing, some pretend play skills, which also goes into language. We can talk about what the characters are doing in the picture. We can talk about or ask some where questions and some when questions with these picture scenes. So we can address a bunch of stuff with picture scenes and fun interactive activities like this. Fluency, going back to, we can use that pacing board in conjunction with this and talk about what's happening. And of course, articulation, find things with our speech sounds in it. So say they're working on the k sound, so we can say, oh, there's some cones down here and there's a big clock on the wall. So anyway, those are a few activities that I've utilized in therapy over the past several years. In terms of our references, pretty much everything is from asha.org, just because it's all in one place and there's everything listed on that website. And then there are those 4, like I said, those quick screening questions, or Heather was talking about, for feeding and swallowing. Those are developed by Joan Arvidsson. But aside from that, all the other information is from our experiences. Heather and I both worked in the schools before coming to UTMB and working in the outpatient setting. So we've kind of seen a variety of stuff.
And Catherine?
Yes.
Catherine?
Yes.
A real quick note on, can you hear me?
Yes.
Okay. A quick note on ASHA. Right now is actually, May is Better Hearing and Speech Month. And so if you go to asha.org, on their main page, there's a section that says Better Hearing and Speech Month. If you click on that, there are a lot of great resources right now. They have a lot of information, some of the similar stuff we shared that you can share with parents, but just a lot of really good information there right now. If you go down a little further on that page with the Better Hearing and Speech Month page, there are resources you can print out. There are flyers, there are bookmarks, there are coloring pages for the kids. I like to always have those available on my door in the waiting room, you know, so they can have those. You can hand them to the parents and the families when they come in. This is every May. So every May they have a different logo, but they have similar information each year. So just, I would encourage you to check into that in May and see all the great resources they have on ASHA, and it's speech and hearing. So.
Perfect. Okay. Any questions or comments? I'm going to stop screen sharing so I can.
Yeah, and also real quick before we do, yeah, so there's our email addresses. Again, like she said, you know, we've worked with primarily pediatric. We've worked in the schools. We've worked in the outpatient clinics. I actually had a lot of work with kids with hearing loss as a speech language pathologist and a teacher, and so we've got a bunch of stuff we've worked on. If you have any specific questions for us that maybe come up later, please feel free to email us.
Yep. Yes, ma'am. Okay, let me stop sharing. I don't see any questions or comments. Are there any? Okay. If you guys have any questions, feel free to reach out. We hope you also have some good resources, like we said, for not only for you all to review or to have in your clinics, those checklists, but also for parents as well. That's a big thing, especially right now that we can't see all of our patients face to face. So yeah, we want to really put those resources out there and for you to know where to access them. Okay, you guys, thank you so much for joining us this morning. This was so fun.
Yeah.
And yeah,
Thank you all for being here. We appreciate you. Your institution has really supported us during this, and we definitely appreciate it. This was recorded. I'm going to edit it, and it'll be up on our website tomorrow. Awesome. We have noticed that live participation has kind of gone down a little bit as states are starting to ramp back up.
Right.
And loosen some reins, you know, especially in healthcare. So, but we are getting a lot of hits on our videos. We have over 10,000 views.
Oh, wow.
Videos. So,
nice.
Residents and med students are just loving this as a resource. So I just want to thank you so much.
When you do the videos, do you have a link on your website too, also to our PowerPoints and stuff, or is that available?
Yes, once you, if you send us, which I think, Catherine, you
I
did.
did, yes, ma'am.
Yep, we put a link on there with the video link. So a handout file, quote unquote. So if you go to the past videos page, you'll see it under the date that you give your lecture. And yeah, and the residents can go and use it as well. So
Excellent. Well, thank you for giving us this opportunity. I'm glad y'all are
Yes,
doing
thank you
this.
so much. This has been great. Thank you, guys.
thank you.
Bye.